Hi everyone, today I am giving you information on the topic hypermetropia. Another name of hypermetropia is hyperopia. So let's move to its description. Hypermetropia is a condition in which the parallel rays of light coming from infinity are focused at a point behind the retina when the accommodation is at rest. So let's see here. It is a normal eye. Parallel rays of light are coming from the infinity and they are focused on the retina in case of normal. If we will consider all the parallel rays of light coming from infinity means a very far they are coming and they will focus on the point which is on the retina. It is a normal case, okay, but in case of hypermetropia they will focus at the point which is behind the retina. Okay, so here the rays are focusing which needs to be focused on the retina and when the accommodation is at rest. As we all know that the accommodation is done by the crystalline lens. This is the crystalline lens. The ciliary muscles and the zonular fibers helps the crystalline lens to accommodate. Okay, so when the accommodation is at rest, at that time the parallel rays coming from infinity they will focus at the point which is behind the retina. That condition is known as hypermetropia. Okay, next one, hyperopia is also known as far-sightedness. Okay, in case of far-sightedness the person is not be able to see the near objects clearly. He is able to see the far objects clearly. Okay, in this case a person is unable to see the near objects. Okay, so in this condition the person is not be able to see the near objects clearly, but he is able to see the far away objects. That is why it is known as a far-sightedness. So there are the two names, hypermetropia as well as the hyperopia. Both are one and the same thing. Next one, etiology. Okay, first one is axial hypermetropia. Next one is curvatural hypermetropia. Third one is index hypermetropia. Fourth one is positional hypermetropia, and the fifth one is absence of crystalline lens. Okay, let's see one by one. Axial hyperopia or the axial hypermetropia. It is one of the most commonest form. It is a condition in which total refractive power of the eye is normal, but there is an axial shortening of the eyeball. Now, what is axial length? If you can see here, from the cornea to the retina is the axial length. Okay, so it is the normal axial length of the eye, and if you can see the hyperopic case the axial length get reduced. Okay, so in case of hypermetropia the axial length of an eye becomes short. Let's move to the next, curvatural hypermetropia. Now it is a condition in which the curvature of the cornea, lens or both is flatter than the normal, resulting and decrease in the refractive power of the eye. So let's see now. This one is the normal curvature of the cornea, okay, which is shown in the dotted line, but when you can see this is flatter. Okay, this area becomes flatter. Okay, in case of hyperopic eye the curvature of the cornea means normally the cornea becomes curved and it becomes flat in case of hypermetropia. Okay, so this is known as curvatural hypermetropia, due to which the refractive power of the eye becomes decreased due to its flattening. Okay, next one is index hypermetropia. Now index hypermetropia, it occurs because of the change in the refractive index of the lens. As we all know that the crystalline lens is present in our eye, so as the crystalline lens becomes cataractous, as the cataract develop in the crystalline lens, so the refractive index of the crystalline lens become changed. It occurs in the old age mostly. Okay, it may also occur in the patient which have the diabetes, because in case of diabetes the patient have early cataract condition. Okay, so early development of the cataract takes place in case of diabetic patient. So when the refractive index of the lens changes, then a person will be more hyperopic. Next one, positional hypermetropia. Now it results from posteriorly placed crystalline lens. After doing the cataract surgery, we will place the posterior intraocular lens. So how it is positioned. So uh, how is it positioned depends upon, sometimes the person becomes hyperopic after inserting of PCIOL in the eye. This is positional hypermetropia. Okay, next one is the absence of crystalline lens. Now the absence of crystalline lens, this one is the crystalline lens. Okay, if you can see here that this is the lens. Okay, normally the lens need to be placed here, it is a position of the lens. Okay, so sometimes it becomes absent, so that condition is known as aphakia. Absence of crystalline lens, it may be congenital at the time of the birth of a person, it becomes absent, or sometimes it takes place in the acquired cases. Okay, sometimes we will remove the crystalline lens during surgery because of some complications, and sometimes posterior dislocation takes place. Okay, so here is the posterior dislocation of the lens takes place. Okay, so the lens needs to be present here, but if you can see the position of the lens in this eye, so it becomes upward somewhere. Okay, so the position of the lens become changed. This is the posterior dislocation of the lens. And if we talk about the aphakic eye, in which the lens become removed. Okay, how you can get that the lens becomes removed, we will just shine a torch inside the patient eye and will examine. The reflexes should be seen here. Okay, two reflexes should be seen here. If the reflexes are not seen here, then it is clear that the person is aphakic. There is absence of crystalline lens. Okay, now absence of crystalline lens takes place in two ways. Sometimes it is congenitally absent, and sometimes the posterior dislocation of the lens, and sometimes there is a aphakia. Okay, let's move to the next. It also leads to the high hypermetropia, means more plus power should be given to the patient. Next one is total hypermetropia. Now we will discuss about the components of hypermetropia or the components of hyperopia. Total hypermetropia is the amount of total refractive error which is estimated after complete cycloplegia with atropine. First of all, we will dilate the pupil of the patient. Okay. Now, if you can see that this is the dilating pupil, if you can see the pupil, then it becomes very large. So it is a dilating pupil and it is undilating pupil. When the pupil gets dilated with the help of atropine or any kind of cycloplegia, then we will find out the total hypermetropia. In case of total hypermetropia, total plus power which is required by the patient, it consists of manifest hyperopia as well as the latent hyperopia. Okay, next one is latent hyperopia or the latent hypermetropia. Latent hypermetropia implies the amount of hypermetropia about 1 diopter which is normally corrected by inherent tone of the ciliary muscles. Okay, now here if you can see that these are the ciliary muscles. Okay, this is the lens. The ciliary muscles helps to accommodate the lens. They will help so that the lens can accommodate, and sometimes the picture will becomes clear. Okay, so they will focus on the image and helps us to see clearly. Now, the degree of latent hypermetropia is high in case of children. The latent hypermetropia becomes very high in case of children. As the age of the children increases, then the hyperopia becomes decreases. Okay, so as the age of the person increases, according to increase with age, the plus power of a person will reduce. So there are the chances so that the plus power become reduced in case of the patient. In case of the children, it is disclosed when refraction is carried after abolishing the tone of atropine. Okay, we will find out by abolishing the, in case of dilatation. Okay, after dilating the patient with the atropine, we will find out the latent hypermetropy, because the 1 diopter is corrected by the ciliary muscles. Okay, if there is a plus 1 diopter hypermetropia takes place in case of patient, then it becomes properly corrected by the ciliary muscles. There is no need to give spectacle power to the person. Next one, manifest hypermetropia. In case of manifest hypermetropia, it is the remaining portion of the total hypermetropia which is not corrected by ciliary tone. Okay, so we will know that the ciliary muscles will just correct the one diopter of hypermetropia. So the after lefting the one diopter of hypermetropia, the leftover part of hypermetropia is the manifest hyperopia, and we are supposed to give the correction to the patient for this. It consists of two components. First one is facultative hypermetropia and the second one is absolute hypermetropia. Okay, in case of facultative hypermetropia, it gets covered by the accommodation. Person needs to be dilated to measure the total hyperopia. In facultative hyperopia, a person has no need to wear spectacle. Okay, so in case of this, first of all we will dilate the patient. Okay, and next one we will see the amount of the hypermetropia. It get covered by the accommodation, as we all know that the lens will accommodate because the ciliary muscles as well as the zonular fibers helps to accommodate the lens. They will shorten, they will contract as well as relax so that the person can focus on the image and the image will sees to a person very clearly. So it is the facultative hypermetropia which gets covered by the accommodation. Person will accommodate and we are not supposed to give any correction to the patient. It gets completely correct by itself. Okay, so next one is absolute hypermetropia. In case of absolute hypermetropia, it is the residual part of manifest hypermetropia which is not corrected by the patient accommodation efforts. Patient will accommodate more and more, but it will not correct. The person is not be able to see the things clearly after doing accommodation. So wearing of spectacle is compulsory. In this case, it is used to give clarity to the nearby objects. So we will provide spectacles here. Okay. Next one, age as well as hypermetropia. Now, what is the relation between the age and hypermetropia? At the time of the birth, the eyeball is relatively short. Okay, when the birth of a person takes place, then the eyeball becomes relatively very short, having +2 to +3 power of the hypermetropia at the time of birth. But we are not supposed to give any correction to the patient. Okay. Next one, it gets gradually reduced until the age of 5 to 7. So that power which was the +2 or the +3, it starting gets reduced when the person becomes at the age of 5 to 7. Next one, eye becomes emetropic. Now the emetropic means eye becomes normal after the age of 7. Gradually it becomes normal till the age of 40. After then there is a tendency to develop hypermetropia again. Okay, so these patients are known as presbyopic patients after the age of 40, which gradually increases until the extreme of the life and the eye has the same to +2 to +3 power which gets started. Okay, at the time of the birth the hypermetropia was present, which was the +2 to +3, but it get decreases as the age increases. After 40, that condition starts, and at the end of the life it becomes the same +2 to +3 power should be given to the patient. Next one is senile hypermetropia is due to change in the crystalline lens. If any kind of changes takes place in the crystalline lens, then senile hypermetropia takes place. Senile means age related hypermetropia takes place, which I have talked about. After the age of 40, everyone get the plus power. As the age increases from the 40 to 55 and above, the hypermetropia keeps on increasing. Okay, so this was the end. Thanks for your patience listening.